Live streaming from Malawi, we have Professor Mac Mallawa talking about rabies encephalitis.
Thank you. Hello, everyone. This is Mac Mallawa from Blantyre, Malawi, and I have with me various people. On my left here, I have Dr. Elizabeth Nkosi, my colleague, and here I have my Phyllis Jaokili, who is a sister to a 10-year-old boy named Joseph Loudon, who died 2 years ago of rabies encephalitis. So before we go any further, I'm going to present a little bit about rabies encephalitis. I'm starting now. What is rabies? Rabies is an acute viral infection of the central nervous system. It is transmitted usually by biting animals. Human rabies disease is almost 100% fatal. It is caused by a virus through exposure to infected animals, and dogs in rabies endemic areas of Africa and Asia are the most common species of animals that transmit rabies. In America and North America, it's mostly bats, but there have also been reports of human rabies due to bites by cats, jackals, foxes, wolves, and other carnivorous animals. But there's no evidence that rabies is transmitted through consumption of milk or cooked meat of infected animals. Rabies has been successfully controlled in many parts of the world. However, there's an estimated 25,000 deaths every year in Africa, with about 1 death every 20 minutes. Children are mostly at risk as they tend to get in contact with infected animals more frequently. In the UK, since 1946, there have been 25 cases of human rabies reported. They've all been associated with exposure to rabid animals in countries outside the United Kingdom, most of the Philippines, Nigeria, India, and South Africa. The virus gets through if the skin is broken. It never gets through if the skin is intact. It can be caught through scratches, damage to the skin, but rabies can't be transmitted from human to human. The human is a dead-end host. Although there have been very occasional cases whereby if there's been contact with saliva through broken skin, there is a potential for transmission of rabies through that. It can be transmitted through transplantation of tissue organs from someone who died of rabies. That's been reported elsewhere. And you may ask, what are the signs and symptoms and how do we make a diagnosis of rabies? Rabies infection occurs after an incubation of anything between 20 days and 90 days. Sometimes it may take longer, even years. It spreads through the central nervous system and eventually it becomes a multi-organ disease. Early symptoms of rabies can be non-specific. It can mimic any viral infection, although there may be an initial neuropathic pain at the site of the bite or the healed wound. There may be itching of the site, the scar. There may be weakness of the affected limb, and eventually it progresses and involves the whole human being, the whole body, through the central nervous system outwards. Other symptoms, as I've said, often non-specific, including fever, general weakness, headache, intolerance to noise or air or light, or they may have episodes of anger and depression. In 80% of the cases of rabies, it progresses to what's called encephalitic or otherwise called furious rabies, which is characterized by episodes of generalized arousal, hyperexcitability, separated by lucid periods. There may be autonomic dysfunction and hydrophobia, which is essentially fear of water, and or aerophobia, fear of air. The remainder, 20%, develop what's called paralytic rabies, which results in quadriparesis, weakness of all four limbs, and it tends to be flaccid paralysis. There may be associated sphincter dysfunction, which is sometimes difficult to diagnose. But it is not known why some patients present with furious rabies or others present with paralytic rabies. Diagnosis of rabies is mostly clinical, based on symptoms and history of exposure. But sometimes that history of exposure is not always available. Some cases of rabies have often been misdiagnosed as other sinus infections like malaria, meningitis, in cases where they don't present with specific encephalitic form of rabies. Why do patients with rabies die? Death often occurs because there is cardiac or respiratory failure, and typically within 7 to 10 days after the onset of first symptoms. That's if there's no intensive care facilities available. Is there any treatment for rabies? Presently, there are no successful protocol therapies for treatment of rabies. There was a protocol treatment, the Milwaukee treatment protocol, that resulted in a survival of a 15-year-old girl who developed signs of illness. It included a combination of vaccine and viral drugs, anti-rabies vaccine, anti-rabies immunoglobulin, and anesthetic agent ketamine. This was essentially to induce coma. But there have been further attempts after that to repeat the protocol. Those attempts have failed. In the case of the Milwaukee girl, success of this therapy resulting in survival was thought to be more due to the individual's immune response rather than the treatment itself. So essentially, we can say there's no definitive protocol for treatment of rabies. Care in hospital for patients with rabies encephalitis consists of essentially sedation, keeping the patient free from physical pain and emotional support in a quiet, dark room. Intravenous fluids are recommended because often patients are unable to drink because of the hydrophobia and they become progressively thirsty. Care needs to be taken when dealing with patients with rabies in terms of exposure to the saliva. Exposure to the saliva on broken skin can potentially result in rabies transmission. What are the preventative measures for rabies? Rabies is 100% preventable. There is the exposure prevention, but also post-exposure prevention. The WHO recommends 2 pre-exposure vaccination schedules, intramuscular and intradermal. The use of intradermal immunization regimen is recommended as it requires smaller quantities of the vaccine and than the intramuscular one and gives better antibody response. The vaccine provides immunity only for a limited period of time, therefore you need boosters depending on the level of the risk. In the event of rabies, post-exposure prophylaxis is still required even for those that have received pre-exposure vaccination. Rabies can effectively be prevented after recognized exposure through post-exposure prophylaxis, which includes wound cleaning, thorough wound cleaning, active immunization with multiple doses of anti-rabies vaccine and passive immunization with human rabies immunoglobulin injected into and around the wound and intramuscularly. The aim of the post-exposure prophylaxis is to prevent the virus going into the central nervous system. It is effective only before the signs of the illness begin. The moment the signs start, then there's no treatment at all. The pre-exposure prophylaxis, post-exposure prophylaxis, cannot be effective. WHO recommends the first aid strategies at the, in case of rabies exposure. Wash and flush the wound with soap and water for about 10 to 15 minutes. Clean the wound with about 70% alcohol or ethanol, or use iodine as antiseptic. And you need to contact health facility immediately following exposure. Again, prevention really essentially is about dog control, dog control and immunization. Dogs, because are the main source of transmission of rabies to humans. Mass vaccination is recognized as the most cost-effective and sustainable way to eliminate rabies in humans. What message should go to travelers to endemic areas? They need to be aware of the risks of rabies and take preventative measures, which include knowing if the country they visit is endemic, getting informed about pre-exposure measures, these areas, and what to do in case of exposure. Vaccination before traveling into these areas of high risk is recommended, and avoiding contact with animals if possible. Even a bite from what appears to be a harmless pet must be considered carefully. What are the challenges that we face with rabies prevention and control? Rabies mainly affects poor and marginalized populations. Rabies is a 100% preventable disease. However, people are dying of rabies because of lack of education or financial means. People do not know about rabies, what to do in case of exposure, or anything about pre-exposure prophylaxis. Pre-exposure prophylaxis or post-exposure prophylaxis is not available in many areas, particularly the developing world. No financial means to access pre-exposure vaccination, or for that matter, post-exposure immunization. Dog vaccination is difficult to implement in some areas, and healthcare professionals haven't got adequate training. There's also a lack of effective preventable human and vet programs and strategies and effective surveillance programs. Even though we know rabies is a notifiable disease, the reported data is not accurate. Recent studies have shown an increase in incidence of human rabies infection in children in some parts of the world, particularly Africa and, for example, Malawi. In other parts of the world, particularly Latin America, it's been shown that elimination of canine rabies has resulted in elimination of human rabies. This approach recognizes the importance of mass vaccination and effective surveillance across human health and veterinary sectors. Ladies and gentlemen, Rabies encephalitis is a condition that is almost every case results in death. The subsequent devastation wreaked upon the surviving family members is heartbreaking. Ladies and gentlemen, at this juncture, I want to introduce you again to members of this team. First of all, Dr. Elizabeth Nkosi, my colleague, and also Phyllis Joakili, who is a sister to a 10-year-old lovely boy who died about 2 years ago of rabies encephalitis.
Thank you very much. Just a small summary of the case of Joseph Loudon, late Joseph Loudon, who died of rabies. So Joseph was a 10-year-old, was presented at our hospital, Queen Elizabeth Central Hospital, which is a tertiary hospital, on the 12th of April 2013. And he died 2 days later on the 14th of April 2013. So he had a history of being bitten by a dog that was a stray dog 3 months prior to admission to Queen Elizabeth Central Hospital. So this dog also had bitten 2 other children in the same village. The family, after he had gotten the bitten, the family tried to get the first aid through a primary health center nearby. So when they presented there, they were advised to get anti-rabies vaccine. But unfortunately, during that period, they did not have any anti-rabies vaccine. For the other 2 children that were bitten, they managed to source privately the anti-rabies vaccine, and they are alive until today. And after the family had presented at the health center, they cared for the wound and the wound healed. But 3 months later, the child started to develop a headache. And this headache, it was a minor headache, was not associated with any fevers, and was being relieved by paracetamol. But the symptoms worsened because the child started developing other symptoms. So it was being aggressive and had hypersalivation, and according to the sister, was refusing to bath. When she attempted to try and tell the child to go and bath, the child, after being forced, still refused to bath. And because of this, they presented back to the primary health center. And when they went to the primary health center, they did a simple test where they, after presenting with the history of a dog bite, they did a simple test where they took water and tried to make him drink. But at the moment the child stopped, the child refused to drink. They had suspected that the child had rabies, and hence was referred to Queen Elizabeth Central Hospital. So when they presented at the Queen Elizabeth Central Hospital, they also had high suspicion of rabies, because the child had also presented. They had also said that they were refusing to eat and was also refusing to drink. They tried to give him water and he refused to drink. And at the moment, after consulting with the seniors, they had an impression that this child had rabies. So how this child was managed, this child was isolated, was admitted and isolated, and basically we did not have any other medicines that we could give to this child, because it was symptomatically presenting as rabies. So we did sedate the child. We counseled the family and told them that there was no medications that we could give. The only thing that we could do is just keep them comfortable, and everything else at that moment was anticipated. And they were also told that the child was mainly going to die. So after 2 days, the child died. So now, I would like to just present how the family was affected by the death of this young boy. So I'll ask some questions, and she does not know how to speak English, so I'll mainly interpret most of the information that she will give us. Mai, anobano sobano tufinoti antwamve kuti imfa ya Josephine kutsanibwanjeje. Le imfa ya Josephine kutsanibwanje.
Imfa ya Joseph ndatipuza kwambiri akubanjali chifukwa chotinoti ndinalewembekezera. Tinango chilandira ngati chinthu cha ngozi ifo yoti mwanayo silinalibatsike.
So Phyllis says that after the death of Joseph, the family was greatly affected because they did not anticipate that the child would die, and the way the child died, the way the child just died, they did not expect it because it was not very, very sick.
Tinali ndi chiyembekezo choti ngati tapita ku chipatala tili pakati kuti mwanayo apeza bwino. Tinali kwambiri atatitumiza chipatala chachikulu, madokotala atayesesa njira zawo anatimasula kunena kuti mwanayo libe thandizo lonse limene angathe kumpasa kuti apezenso bwino.
So they say the family, after being referred from a primary health center and going to a tertiary hospital, which they thought was a big hospital, and they had this hope that this child is going to get better, but unfortunately they were being told from there with the senior doctors, they were being advised and told that this child, there's no medication, there's no intervention that could be given, but anticipated death.
Ndizowawa ndiponso zimatiwawabe akubanjali mpaka na lero ifo tinali chinthu chosayembekezera. Tinali ndi chikhulupiriro kuti pamene mwana itapita naye ku chipatala apeza bwino, lero kuti masuwa unozo kuti mwanayo sapeza bwino futi chiwewe chilibe mankhwala, tinkangoyembekezera tsiku ndi nthawi.
So they as a family were greatly affected because when they went to the hospital, they were being told that with rabies, that there is no any medicine, there's no any intervention, and that they were told that the child is going to die. Nanga kumuzi. Zinakukhudzani bwanji kumuzi?
Umuzi zinatikhudza kwambiri pachifukwa chokuti mwana yetu mamudalira kuzinchito zina, komanso panopa ndizoti zimatiwawa kwambiri kuona zoti azinzake amene anabadwa nawo limodzi tiwaona, komanso amene analumidwa nawo galu limodzi enawo tiwaona, komanso azinzake amene amaphunzira nawo sukulu panopa ali standard 5 tikamuna chimene chimakhala chokupereka wanu.
So she is explaining that as a family they were also affected back at home because they are able to see other children of his age that are going to school, that are now in standard 5, and now that they are all alive and they are all doing well. And also the other fact that pains them a lot is because the other 2 children that managed to get the anti-rabies are alive and well back at home. So they feel like they have lost a child who was more beneficial to have in the family.
Apa chibale timati tikakhala basi kukumbusana za nkhani imeneyi wina aliyense amalephera kumvetsa chifukwa zamene zinakhaliramo sitinayembekezere.
So when they sit down as a family, when they remember about the whole incident, how it happened, it is very painful, something that they cannot grasp, something that they haven't come to terms to because it was very sudden and painful death. Nanga kumudzi kosefu kulibwanji zinakukhudzani bwanji?
Kumbali ya anthu losa kumuzi zinatikhudza chifukwa chonena kuti imfa inakhala yodzidzimutsa sitinayembekezere. Inde imfa inalengedwa, timadziwa zokuti imfa ndizoti unalese zamufikira, koma pa imfa imene inamufikira mwana amene ndizoti timati tikaganiza ndikukumbukira mitima imakhala yobalalika kwambiri.
So as a community, they were also affected because it was an anticipated death and they didn't think that a child was going to die, but they know that death is everyone is supposed to die, but the way Joseph died, it affected the whole community and also the family as a whole. Thank you.
Thank you, Dr. Chintolo and my fallacy, Joakili. The death of Joseph Loudon, it just represents one of the many cases of rabies we see in Malawi and I'm sure in other parts of Africa as well. Just to mention again, I had a chat again earlier on with fallacy, with late Joseph Loudon's sister, that, like Dr. Chintola has mentioned, this dog that bit Joseph went on to bite 3 other kids. And Joseph got bitten essentially when he was trying to protect one of the girls that got bitten, and he got the dog bite in the process. The other children managed to get anti-rabies vaccine, but for your information, a course of anti-rabies vaccine costs about $60. The other families struggled to get the anti-rabies vaccine, and that's why their children are still alive at the moment. Joseph's family were unable to afford a full course of anti-rabies vaccine, and the mother, the sister, and everybody immediate to Joseph feel really helpless that they didn't do anything, should have done better, help Joseph. But $60 for most families in Malawi is way too much for them to afford. But unfortunately, that's the state of affairs where anti-rabies vaccines in Malawi are concerned. So it's a devastating disease, and unfortunately, there are not that much we can do with, like mentioned before, dog immunization is probably the most cost-effective and sustainable way of dealing with rabies in Africa. There's been data that shows that actually what we present here, the figures that we've presented, are probably just the tip of the iceberg. There's more rabies cases happening out there than we are we were able to identify. And there's been some mathematical modeling exercises that have shown that for every case that dies in the hospital, there's probably another 100 cases that have gone unreported in the communities, rural communities, in areas across Africa.
Thank you very much. So with the questions that most people are actually asking out there, there's one question that's to you, Mark, is to say, what can you do to prevent getting rabies?
Thank you for that very important question. Essentially, to prevent getting rabies is to prevent getting bitten by dogs, which is the main type of animals that transmit rabies in Africa, most of Africa. If you can avoid getting bitten by a dog, then you will not get rabies at all. But as most people that have been in Africa know, most dogs that carry rabies in Africa are stray dogs. Therefore, you meet them everywhere you go. You meet them on the streets. You meet them anywhere. You can't avoid them. The best, therefore, is to say, okay, get pre-exposure prophylaxis. But again, for most people in Africa, and rabies vaccine, pre-exposure immunization is way beyond their affordability, so it's impossible. But what we need to do is to try to improve the number of children. And the problem is, most children that get rabies in most cases, because they are the ones that are out there in playing with friends, and often sometimes they're heroic. They see an animal, they want to chase it away, and in the process they end up being bitten by the dog. So if we can prevent children being bitten by dogs, us being bitten by dogs, but once bitten, or even before that, getting pre-exposure prophylaxis is the way to avoid getting rabies. But like I said before, the most important is essentially if we can immunize all dogs. But again, that's got all sorts of challenges, which I think is beyond the scope of this discussion, but there's lots of challenges associated with that.
There is also an interesting question that comes, is saying that what is the biggest challenge in raising awareness in Malawi?
In Malawi, the biggest challenge is essentially getting people in the community, rural communities, appreciate the gravity of rabies, appreciate the importance of having their dogs get immunized. But that is sometimes difficult because there are lots of stray dogs. We are, as human beings, we believe dogs are pets, and to get that mentality that yes, they are pets, beautiful pets, but we need to be aware of the fact that they do transmit dog rabies. Therefore, we need to take into account that fact and therefore have them immunized. So that's number one. Number two is education amongst the healthcare workers about the importance of rabies, awareness of rabies as a fatal disease. But also, again, I think there need to be more working relationships between the veterinary department and human medicine in control of dogs, including vaccinations of dogs and therefore and vaccination of humans as well. So those are the few challenges that we face in not just in Malawi but most other parts of Africa as well.
Another interesting question is to say, how can you get anti-rabies vaccine, let's say in Malawi?
In Malawi, all drugs are provided by the state. So all anti-rabies vaccines should be available in most district hospitals and most referral hospitals. But because rabies vaccine is quite expensive and the many competing expenses where medical equipment, drugs are concerned, therefore it's not always possible, much as we'd love to have anti-rabies vaccines in all district hospitals and referral hospitals, but it should be available. The private sector also should have anti-rabies vaccine, but it's not always in stock. I do remember a 26-year-old boy about a year ago who got bitten by a dog, went from one private facility to the next looking for anti-rabies vaccine, didn't get any. 1.5 months down the line, had rabies, serious rabies. 2 days later, they died. So even though you may have money, sometimes it may not be available even in the private facilities where you think it should be available. Mainly it's because of cost. It is very costly for countries like Malawi. However, dog anti-rabies vaccine is much cheaper. Therefore, the best way to control rabies is essentially to target the animals, the dogs.
There is another question that says, what message would you give other doctors about this condition?
Every doctor needs to be aware. Every healthcare professional needs to be aware of rabies, how common rabies is. I mentioned in my presentation that there's underreporting. The figures we have nationally in the national database of rabies cases is far below the accurate figure. But rabies is very common and endemic in Malawi. Therefore, they need to be aware of its gravity. They need to be aware of the importance of pre-exposure prophylaxis, but they also need to be aware of what to do first with the dog bite. They need to be aware of the basic first aid. Washing, wound washing, washing thoroughly for 10 to 15 minutes with soap and water, and then wash thoroughly with alcohol, including the locally distilled distills in the communities. You can use that to thoroughly wash the wound. That's very important. That goes a long way in reducing chances of that rabies, that dog bite becoming or converting into rabies encephalitis. And then they need to be aware of the importance of giving the rabies vaccine, post-exposure prophylaxis, what the duration is, what different regimens there are there, and how effective they are, and how to effectively give it. They need to be aware of that. Every health care professional needs to be aware of that if we are to prevent then the deaths that are associated with rabies.
And then the other interesting question is to say, looking at rabies and rabies as a whole, looking at the incidence and the trend, how has it been, the incidence trend in Malawi or elsewhere as a whole?
Rabies is not on the decline anywhere in Africa. We've seen a decline in rabies cases in South America, but unfortunately in Africa, the rabies cases are on the rise. We need to stick together. We need to have concerted effort if we must reduce deaths from rabies. Remember, it is still a neglected disease. What we must be aware of is the fact that it's 100% mortality. For every case of rabies you get, that's a mortality. So we need to raise awareness at every level, community level, healthcare level, tertiary hospital, medical schools. School children need to be made aware of the gravity of rabies. It's only through that, raising awareness, that we can reduce the incidence of rabies deaths.
Thank you very much. I think that's most of the questions that came through, and I think most of the questions have been answered. And thank you very much.
Thank you very much all for listening. Thank you everyone for participating. It's a very important day, and like I said, rabies is one of the most devastating diseases I've ever come across in Africa, and mortality is 100%. I must thank late Joseph Loudon's sister, Phyllis, and mother, Emma, and also Joseph's nephew, little Collins Yusuf here. I do appreciate that it wasn't easy for you to agree to come to talk about rabies, to talk about your late Joseph. I know how you looked up to Joseph. They travel, for your information, this family has traveled more than 50 miles to get here just to be part of this. They are keen to be part of that raising of awareness so that something should be done about reducing rabies incidence in Malawi and in the world as a whole. Thank you very much. Thank you for watching.